We're all tired. We all feel run down by the demands of this year. But we can all carry a bit of hope that this new year is going to be brighter than the old. We're learning a lot more about COVID-19 every day, and we've come a long way from that day in March when I announced the first presumed positive cases of COVID-19 in Pennsylvania. Our country was unable at that point to reliably test for the virus in the earliest days of the pandemic. And now two vaccines, lots changed. Two vaccines have been approved for use in the United States. And the federal government's Operation Warp Speed is working to distribute the vaccines that have been approved to providers all across the country. We've learned how to treat patients who contract severe cases of COVID-19, and then we learned how to treat them even better. Recovery rates are improving, and people aren't staying in the hospital as long as they were at the beginning of this pandemic. But COVID-19 is still deadly, and it still poses an immense danger to our healthcare system if we allow it to get out of control. Still, there's good news. As we await the vaccine, we wait for it to be available to all of us. Now, I don't want Pennsylvanians to have false expectations. Unless the vaccine distribution from Operation Warp Speed increases rapidly, we anticipate that it's going to be months, not weeks, until the vaccine is available for phase 3 distribution to the general public. Right now, we are prioritizing, obviously, vaccine distribution to the most vulnerable, our healthcare workers on the front lines, and to those who live and work in congregate care facilities. The rest of us are going to need to be patient until it's our turn. In the meantime, we can follow the progress of vaccine distribution in Pennsylvania through the Department of Health's vaccine dashboard, and that just launched today. So that's news, and Secretary Levine will talk a little more about that. But that dashboard will provide the number of vaccinations administered by county all across Pennsylvania, as well as demographic information about the people being vaccinated. It's going to help us visualize how many people have received the vaccine, and it's going to help us work toward our goal of providing the vaccine to everyone in the state who wishes to receive it as quickly as possible. This dashboard and the vaccinations it tracks are just two more tools in our toolbox as we stand united against COVID-19. But again, the fight against this dangerous disease is not over. We all need to stay the course, and we all need to continue to do everything in our power to slow the spread of COVID-19 and keep our families and our communities safe. There have been some positive signs lately. Our statewide percent positivity rate went down this week for the second week in a row. And while the number of hospitalizations and deaths remain entirely too high in Pennsylvania, it appears that the number of new cases reported each day has plateaued. That means that our mitigation efforts over the past several weeks have done what they were intended to do. And I thank everybody who abided by the restrictions put in place to protect us. The point is that every time each of us makes a small decision to avoid risk or takes steps to make our actions a little bit less risky, we're helping to stop the spread of this virus, and we're saving lives. So I am announcing today that the time-limited mitigation orders that went into effect on December 12th will expire as planned on January 4th at 8 a.m. That includes 10-person indoor and 25-person outdoor gathering limits. It includes the ban on indoor operations at restaurants and bars and gyms and entertainment venues, and the suspension of extracurricular activities. Now, this does not mean that we're out of the woods, not by any means. We still have significant mitigation efforts in place. All mitigation orders that were put into place prior to December 12th, they remain in effect when the time-limited mitigation orders expire on the 4th of January. And so what remains includes, not exclusive, but includes the mask wearing requirements, that stays. Gathering limits based on venue size, that stays. Business capacity limits, that stays. And restaurant self-certification, all those things stay in place. We need to continue to work together to slow the spread of COVID-19, because if we get complacent and let case numbers begin to go back up, the danger to our communities, to our families, to our healthcare system will return with swift and deadly consequences. We have to continue to monitor the spread of COVID-19 in the Commonwealth closely in the coming weeks, and we will do that. But we can all have hope that next year we're going to be a lot better place. We're going to have a lot brighter ending than the ending that we have in this year. And that hope should energize us to keep our guard up and continue the fight against COVID-19 in the months ahead. By working together, we can keep one another safe while we wait for the vaccine that is on the way.